Yeah, let's talk about the flu vaccine as well. Some people have already gotten them because of the COVID-19 pandemic. The message is out there that it is so important to get your flu shot, especially this year, because the flu and the coronavirus have similar symptoms. There's also a fear a surge in flu cases could then overwhelm the health system.
New poll showing 1 in 3 parents say their child unlikely to get the vaccine. Only 1/3 believe it's more important this year than normally. Are you surprised by this?
I am a little bit surprised, and here's why. Because we've already seen some flu vaccine shortages amongst older people, sort of that heavier dose of flu vaccine. So the message is certainly getting out to older people, which it generally does. But I think the messaging has been very consistent from public health officials, from providers, from physicians, from nurses to say it's really, really important to get your flu shot this year. And it doesn't seem like we're budging all that much on how many kids are going to be getting their flu shot.
Yeah. Well, I will say that, I always get the flu vaccine. My kids get the flu vaccine. I know that the flu vaccine isn't great, right? Like, it's not a great vaccine. It's not perfect. But to me, I would rather have a vaccine with a 40% chance of working than 0.
Absolutely. It is not perfect. Of course it's not. And no one ever had said that it is perfect.
Yeah.
But what it is it gets you better. It gets you better to where you need to be. And the more people that get the flu vaccine, the better off we are. And, we don't know whether it's 40% or 60% effectiveness. We just don't know here yet.
Right.
But something that I think is important here is the biggest concern that people say they have is the side effects.
Sure.
And there are some side effects.
Yeah.
You can't get the flu from the flu vaccine. We've
Despite
known
what
that.
people think.
But some people, you can get a couple sniffles. You might get a little redness. And for sure, that happens. But it's not as though you're getting sick from the vaccine. Right?
I struggle a little bit with this idea that everyone needs to get the flu vaccine because of COVID, because there might be confusion. I think there's going to be confusion no matter what. Like, people should get the flu vaccine because you should get the flu vaccine.
Right.
Like,
exactly.
I don't know. To me, the COVID situation, I don't make the link. I understand what the health experts are saying, that if we can get fewer people to catch the flu, that's fewer people coming to doctors and saying, I've got these symptoms.
Right.
So maybe it'll be easier to identify COVID. Like, to me, you're asking people to do a lot of work there. The reason to get the vaccine is to get the vaccine.
Yes. And I'm not sure you're asking people to do a lot of work, because what you're asking people is to do what they can to sort of prevent not only their own children, but other children from getting sick, from the public at large to get sick. Another interesting stat here was 14% said they want to keep their kids away from healthcare sites. And over and over and over, and we've talked about it on this show as well, these healthcare sites are really working hard to make it safe for people to bring their families in to be able to get the flu shot. And you see a lot of those drive-up clinics too, if you really are scared.
Yeah, I think it's good. Get the flu vaccine. Makes a lot of sense, But parents will make their own decision, and if a third don't do it, 3/4 do, I think that's good news. So.